गुड इवनिंग एवरीवन। जैनु की पाठशाला यूट्यूब चैनल में आप सभी का फिर से स्वागत है। आज हम बहुत ही महत्वपूर्ण टॉपिक वेटनरी पैथोलॉजी जो यूनिट 4 के अंदर पैथोलॉजी ऑफ द इन्फेक्शियस एंड द नॉन इन्फेक्शियस डिजीज ऑफ द डोमेस्टिक एनिमल, जो यूनिट 4 के अंदर उसको MSV 2016 के हिसाब से उसको बाइफर्गेट किया गया है। और जनरली जो यूनिट 4 है वो पेपर 2 में कंसिडरेशन होता है जब एनुअल बोर्ड की एग्ज़ाम होती है। तो आज हम जो भी यूनिट 4 के अंदर इम्पोर्टेंट जो क्वेश्चन है एग्ज़ाम पैटर्न के हिसाब से, इंटरनल और द एक्सटर्नल एग्ज़ाम मीन्स एनुअल बोर्ड के हिसाब से, हम जो भी उसके इम्पोर्टेंट क्वेश्चन है उस पर हम चर्चा करेंगे। इस वाले लेक्चर में मैंने लास्ट 5 साल के जो इंटरनल और एनुअल बोर्ड के एग्जामिनेशन के जो पेपर हैं उसमें से जो यूनिट 4 से जो क्वेश्चन बनते हैं उसके बारे में मैंने आज चर्चा की है। तो सबसे पहले हम इस यूनिट 4 से जो इम्पोर्टेंट क्वेश्चन है उसमें मैंने इस पार्ट को 2 में डिवाइड किया है। पार्ट 1 मीन्स ऑब्जेक्टिव पार्ट और पार्ट 2 है जो सब्जेक्टिव पार्ट है, और दोनों को हम इसी वीडियो में कवर करने वाले हैं। सब लोगों को एक विनंती है कि जो भी इस यूट्यूब चैनल जैनु की पाठशाला यूट्यूब चैनल में नए हैं वो इस यूट्यूब चैनल को लाइक करो, शेयर करो और सब्सक्राइब करो। और ये वीडियो देखने के लिए आपको बहुत ही महत्वपूर्ण चीज़ें इसमें सीखने को मिलेगी, तो एंड तक आप इस वीडियो में बने रहिए। सबसे पहले हम ऑब्जेक्टिव पोर्शन की बात करेंगे। तो ऑब्जेक्टिव पोर्शन में सबसे पहले जो इम्पोर्टेंट पार्ट है उसमें फिल इन द ब्लैंक है, मीन्स आपको वन वर्ड या वन आंसर में एक आंसर देना है। तो सबसे पहला जो क्वेश्चन है कि टिग्रोइड हार्ट अपीयरेंस आर द सीन इन कैटल इन विच डिजीज। तो टिग्रोइड हार्ट अपीयरेंस यू ऑल नो दैट इट इज सीन इन टू द FMD, फूट एंड माउथ डिजीज। सेकंड क्वेश्चन है कि किडनी अपीयरेंस seen in enterotoxemia. Which type of the kidney? Means what is the appearance of the kidney which are they appeared into the enterotoxemia, that is the pulpy kidney disease. It means the pulpy type of the kidney are they appeared into the enterotoxemia. Third thing, it is the corrugation and the thickening of the intestinal mucosa are seen in which disease? जनरली कोरुगेशन एंड द थिकनिंग ऑफ द इंटेस्टिनल म्यूकोजा, जोन्स डिजीज जिसको हम JD बोलते हैं, जो माइकोबैक्टीरियम पैराट्यूबरकुलोसिस से ट्रांसमिट होता है, उसमें पाया जाता है। फोर्थ क्वेश्चन है कि इडिमेटियस एंड इडिमेटियस थिकनिंग ऑफ द गॉल ब्लैडर वॉल which is seen in which disease of the dog? So generally it is seen in case of the infectious canine hepatitis. Fifth question है microabscess are the seen in brain in which disease? That means it is observed in particular listeriosis. You all know listeria. It is listeriosis. It is caused by the Listeria monocytogenes, and it is also known as the for the circling disease. Sixth question है it is a lumpy jaw condition is caused by the fill in the blank. Mean it is a lumpy jaw. It is generally caused by the actinomycosis bovis, and it is condition is also known as actinomycosis. So 7 question है 7 number, intracytoplasmic inclusion body and neuron during the rabies are called as, means intracytoplasmic inclusion body rabies के अंदर जो मिलता है उसको हम नेग्री बॉडी बोलते हैं। नेक्स्ट हम बात करते हैं कि पोस्ट पार्चुरेंट हेमोग्लोबिनुरिया seen in cattle due to the deficiency of fill in the blank. Generally it is due to the deficiency of the phosphorus. Ninth question है कि zebra marking on the rectal mucosa is seen in which disease? And generally it is seen in case of the rinderpest. In sara blood glucose level is found. जनरली सरा के अंदर जो ग्लूकोज है ज़्यादा यूटिलाइज होता है, इसलिए इसकी वजह से ब्लड के अंदर वो जनरली हाइपोग्लाइसेमिया होता है, मीन्स लो लेवल ऑफ द ग्लूकोज वहाँ मिलता है। मेड इज ओजुकिस डिजीज और द स्यूडोरोबिस, इट इज कोज बाय द फिल इन द ब्लैंक, मीन्स इट इज कोज बाय द पर्टिकुलर herpes virus. It is caused by the herpes virus. If you write the herpes virus, that is okay. You don't need to write in detail regarding the which type of the herpes virus. Afterward, the 12th question, the old dog encephalitis is seen in the dog recovered from the which disease? It is generally canine distemper जो disease है उसकी जो sequel है वो sequel है, that is the old dog encephalitis. Which tests are used to detect the glanders in horse? You all know the gallglander condition, which are the one of the notifiable disease, and the Mellin test are used to detect the glanders in horse. 14 question, Khaljigia means it is the most important lesion of the splenic fever or anthrax. Means which are the most important lesion which are observed in particular anthrax, and that is the particular splenomegaly. Splenomegaly is the most important lesion observed in anthrax. Afterward, you can also get that absence of the rigor mortis, splenomegaly, and uncoagulated blood coming out from the orifice. These are the most important feature in case of the anthrax. Afterward, that punched out ulcer in abomasum is characteristic lesion of theileria disease. It is punched out ulcer in abomasum observed in theileriosis. स्टोकिया डिजीज जनरली हम जो हेमरेजिक सेप्टिसेमिया है उसको हम स्टोकिया डिजीज बोलते हैं. तो स्टोकिया डिजीज इज कोज्ड बाय द पास्चुरेला मल्टोसिडा. Afterward, the hyperglycemia and the glycosuria is observed in lamb in fill in the blank disease. Generally, you all know the enterotoxemia. Enterotoxemia, also known as overeating disease, in which you will observe the hyperglycemia and the glycosuria. Cyanosis of the tongue in sheep are seen in which viral disease? Actually, cyanosis of tongue इसको हम blue tongue बोलते हैं. तो generally ये blue tongue disease के अंदर पाया जाता है. The parasite found into the esophageal wall of the dog is observed in fill in the blank. It is generally parasite जो esophageal wall में है, that is the Spirocerca lupi. After the last 20 number question, which parasite found into the right ventricle of the dog? You all know we have talked about the filariosis. Means Dirophilaria immitis are the found into the right ventricle of dog. Here we have finished the fill in the blank. Now we will switch toward the particular objective portion in which you have to tick the most appropriate answer. First question is the clinical symptom of the rabies is usually appear as, here the चार option is there, dumb or the paralytic form, furious form, और only A or B or A or B at a time. Means यहाँ पे important है कि कोई एक है, dumb or paralytic or the furious form. हाँ, तो मीन्स यहाँ पे जो आंसर है दैट इज द सी इन फर्स्ट क्वेश्चन. सेकंड क्वेश्चन, द caseation and the calcification is absent or not a characteristic feature. Here it is the answer is the avian tuberculosis, means A, in which no any caseation and calcification is observed. But you remember that in case of the equine tuberculosis, here also no any caseation or the calcification, but the proliferative type of the lesion are observed in particular equine tuberculosis. Means second number question A is answer. Afterward, the punch out ulcer into the mucosa of the trachea and the larynx are seen in which disease? That is the A, answer is A, glanders. You remember this punch out ulcer in mucosa of trachea, that is the glandar. Punch out ulcer into the abomasum, that is the theileriosis. Steely wool angiotic ataxia in the sheep, it is caused by the deficiency of copper. Means answer is the B. Fifth number, scurvy is caused by the deficiency of vitamin C. C answer. Acute septicemic disease, 6 number question. Acute septicemic disease characterized by the bloated carcass and uncoagulated bleeding from the natural orifice. Means यहाँ पे आंसर है A, that means anthrax. 7 number question, Ascolis test performed to detect anthrax from which part? That is the hide and skin are they used to perform the Ascolis test, and Ascolis test it is the thermoprecipitation test. 8 number question, different species of the animal in order to the susceptibility to the tetanus. देखो टिटेनस आता है तो सबसे ज़्यादा ससेप्टेबल है उसमें हॉर्स है. तो देखो यहाँ क्वेश्चन में जहाँ हॉर्स है उसको टिक लगाओ. तो ए नंबर है हॉर्स, उसके बाद जो ससेप्टेबल है सीप, उसके बाद केटल, उसके बाद है बर्ड. मीन्स आंसर इज ए. 9 number question, raised area of the erythema giving an appearance of the diamond on the skin in the swine caused by, उसको बोलते हैं हम diamond skin disease in particular swine. It is caused by the 9 number question. Answer is A, that is the erythrophyllothrix rhusiopathy. 10 number question, abortion usually occur during the last trimester of the pregnancy. Last means 7, 8, 9 month of the pregnancy. वहाँ पे जो important organism है that is the Brucella abortus. Means answer is A, brucellosis. 11 number question, dark field illumination of the leptospira is manifested in. कहाँ से हम करते हैं? यूरिन से हम डार्क फील्ड माइक्रोस्कोपी करते हैं फॉर द लेप्टोस्पाइरा आइडेंटिफिकेशन. आंसर इज ए, यूरिन. 12 number question. 7 immunological distinct serotype of the virus which is epitheliotropic. मीन्स ये किस में पाया जाता है? जनरली जो 7 डिस्टिंक्ट सीरोटाइप है वो एफएमडी के अंदर मिलता है, फुट एंड माउथ डिजीज. जो 7 सीरोटाइप है उसका नाम है AOC, एशिया 1, सेट 1, सेट 2 और सेट 3. अब यहाँ पे क्वेश्चन और भी बनता है कि इंडिया में मोस्ट कॉमन कौन से एफएमडी के सीरोटाइप पाए जाते हैं? तो इंडिया में मोस्ट कॉमन है AO और एशिया 1. यू रिमेंबर दिस पॉइंट मेनी टाइम. This is the most important question. Afterward, the 13th question, that is the roseola, papules, vesicle, pustule, and the discriminative stage, which appear in the sequence in 2 to 3 weeks duration. It is observed generally in pox. Means answer is A. Now again the button shaped ulcer into the intestine and the turkey egg kidney appearance. Turkey egg appearance of the kidney in the pig is seen in which disease? That is observed in particular. Answer is A, swine fever, जिसको हम classical swine fever भी बोलते हैं, जिसको हम hog cholera भी बोलते हैं. Afterward, the 15, the Duncop and the Decop form of the clinical symptom in horse are manifested during which disease? That is the African horse sickness. Answer is A. Anaplasma in the Babesia organism, means babesiosis infection, is manifested in which of the following cell? That is the erythrocyte. 17 number question. Nasal granuloma or the snoring disease caused by an adult worm found in the vein of the nasal mucosa of the cattle. That are the answer is A, Schistosoma nasali. Nasal granuloma, snoring disease, ठीक है, दैट इज द सिस्टोजोमा नेजली. अगर वहाँ पे नेजल पोलिप है और कोई फंगल डिजीज पूछा है तो फंगल डिजीज विच आर द कोजिंग द नेजल पोलिप्स, दैट इज द राइनोस्पोरिडियम सीबेरी, मीन्स राइनोस्पोरिडियोसिस. Afterward, the milk spot. You remember the milk spot on the capsular surface of the liver is generally found in which disease? That is observed in particular Ascaris sum, and this milk spot appear into the liver of the particular pig, and this ascariasis, answer is A, ascariasis, and the etiology is Ascaris sum. 19 number question. A transient corneal opacity involving on the one or the both eye of the recovered dog is seen in which disease? Means कोई एनिमल डॉग है जो रिकवर हुआ है पर्टिकुलर डिजीज से, उसमें कॉर्नियल ओपेसिटी डेवलप हुई है, तो दैट इज द आंसर इज सी, दैट इज द इन्फेक्शियस कैनाइन हिपेटाइटिस. 20 number question. Disease associated with the early abortion and the pyometra in the cattle. Late abortion, that is the brucellosis. Early abortion and the pyometra, that means trichomoniasis. Answer is A. In 21 number question, presence of the large necrotic infract in the liver is seen in which of the following disease? That is the answer is D, bovine bacillary hemoglobinuria. Here we have finished the objective part. Now we will move toward the true and false. True and false. First, that is the intranuclear and the intracytoplasmic inclusion body are seen in canine distemper, whether true is or false. So here first number question answer is true. Both type of the inclusion body seen in case of the canine distemper. Second thing, gas gangrene is seen during the black quarter disease. In BQ we all know gas gangrene is observed, so second number question answer is true. Third number question, bottle jaw condition in sheep is seen during the pasteurolysis. See, bottle jaw condition, pasteurolysis में कोई bottle jaw condition नहीं होती. bottle jaw condition कहाँ पे होती है? Fasciolosis में होती है, एम्फिस्टोमियोसिस में होती है. तो थर्ड नंबर क्वेश्चन आंसर इज स्टेटमेंट इज फॉल्स. Fourth number, wooden tongue condition is observed in actinomycosis. You know, no, there is two condition, actinomycosis and second is actinobacillosis. Actinomycosis, it is responsible for the lumpy jaw and it is caused by the actinomyces bovis. Where in case of the wooden tongue, it is caused by the actinobacillus lingreneri, and the wooden tongue, it is also known as actinobacillosis, not actinomycosis. So fourth number question statement is false. Coach blue body seen in erythrocyte. You all know Koch blue body are observed in thylarosis, but it is observed in lymphocyte, not in erythrocyte. So fifth number question statement is false. Fifth number false. Sixth number Dirophilaria emetis is found in lung of dog. No, wrong. It is a false. Actually, Dirophilaria emetis is found in heart of the dog, right ventricle of the heart. 7. Glycosuria is observed in case of the trypanosomiasis. Means glycosuria trypanosomiasis may observed. Yes, it is observed. Means statement is true. GID in sheep is caused by the coinuris cerebralis. True. True. 9. Splenomegaly is an important finding in pasteurolosis. No, wrong. In pasteurolosis, you will get the pneumonia. You will get the bronchopneumonia. Splenomegaly, you will not get. Generally, splenomegaly is observed in particular anthrax. So, 9 number question, the particular statement, that is the false. Now 10 number question, डायगैंग्रीन of the muscle seen during the black quarter disease. ब्लैक क्वार्टर के अंदर गैस गैंग्रीन होता है, वहाँ डायगैंग्रीन नहीं होता है. सो मीन्स दैट स्टेटमेंट इज द फॉल्स. Langerhans type of the giant cell is found in tuberculosis. Yes, it is a true. True. 12 number question, intestinal corrugation in large intestine are seen in rinderpest. No, intestinal corrugation are observed in particular Jones disease. It is not observed in rinderpest. In rinderpest, you will get the zebra marking. So 12 number question, answer is false. Myoglobinuria is observed in case of the babesiosis. No, babesiosis you will get the hemoglobinuria. So 13 number question, statement is false. 14 question, marbled lung appearance is seen in MEDI. No, marbled lung you will get in case of the CBPP, contagious bovine pleuropneumonia. Means 14 number statement, that is the false. Retrovirus possess the enzyme reverse transcriptase. Yes, it is possess the reverse transcriptase. So statement is the true. 16 number, biphasic fever curve is the characteristic feature of FMD, foot and mouth disease. No, biphasic fever curve you will get in case of the canine distemper. So 16 number question, statement is false. Death in rabies due to the respiratory paralysis. In 17 number question, statement is true. Yes, rabies के अंदर जो डेथ होती हो, इट इज ड्यू टू द रेस्पिरेटरी पैरालिसिस, और उसके बाद वहाँ एस्पाइक्सिया होती है, फिर वहाँ पे डेथ हो जाती है. 18 number question, listeriosis is also known as the circling disease of the ruminants. Yes, it is a circling disease. It is generally observed in particular small ruminants. So statement is the true. Now after the fourth part of that particular objective, that is the match the following. Be careful while match the following. Here I will give the very good match the following. Means one condition you have given and some deficiency of the toxicity given into the B part. First one, that is the slip tendon. It is occurred due to the manganese deficiency. Not a magnesium, it is a manganese. Tartness are observed due to the molybdenum toxicity. Angiotic ataxia, it is observed due to the copper deficiency. Where the angiotic marasmus, it is observed due to the cobalt deficiency. See, remember angiotic ataxia, copper, angiotic marasmus, cobalt. Grass tetany is observed due to the magnesium deficiency, whereas the lactation tetany is observed due to the calcium deficiency. Blind stagger are observed due to the acute selenium toxicity, where in case of the Dengue disease is observed due to the subacute selenium toxicity, whereas the alkali disease is observed in particular chronic selenium toxicity. Shifting lameness are generally observed in particular fluoride poisoning, fluoride toxicity, chronic fluoride toxicity. Second one means swamp fever. It is known as the equine infectious anemia. Aphthous fever, it is known as FMD. Red water fever, it is known as babesiosis. Cathedral fever of the sheep, it is known as the blue tongue disease. Malta fever, it is known as the brucellosis. Deer fly fever, it is known as tularemia. Shipping fever, it is known as the hemorrhagic septicemia. Parrot fever, it is known as the psittacosis. Enteric fever, it is known as salmonellosis. Splenic fever, it is known as anthrax. Malta fever, it is known as brucellosis. Splenic fever, it is known as anthrax. Don't be confused between the Malta and the splenic fever. After third one means pathognomic lesion is given, and from the disease you have to identify thylerosis, that is the punch out ulcer into the abomasum. Glandar, in which the punch out ulcer into the nasal septum. Swine fever means button ulcer in large intestine. Anthrax means splenomegaly. मीन्स एंथ्रेक्स में स्प्लिनोमेगाली मिलता है, मैंने आगे भी बात की है. ब्लैक क्वार्टर मीन्स वहाँ पे क्या होता है, जनरली गैंग्रीनियस मायोसाइटिस, मीन्स गैंग्रीन भी होता है, मायोसाइटिस भी होता है, और गैस गैंग्रीन वहाँ पे फॉर्म होता है. एंटेरोटॉक्सेमिया, वहाँ पे कैसी किडनी मिलती है, पल्पी किडनी. लेप्टोस्पाइरोसिस, वहाँ पे क्या मिलता है, किडनी पे अफेक्ट करता है, मीन्स इंटेस्टिनल नेफ्राइटिस. इक्वाइन एंसेफेलोमाइलिटिस मीन्स वो ब्रेन को अफेक्ट करता है, तो ब्रेन के अंदर लीजन प्रोड्यूस करता है, लीजन इन ब्रेन. एक्टिनोमाइकोसिस, आई हैव टोल्ड दैट इट इज रिस्पॉन्सिबल फॉर द लंपी जो. लंपी जो मीन्स इट इज अफेक्टिंग द हार्ड बोन. सो हार्ड बोन के अंदर वो क्या प्रोड्यूस करते हैं, ग्रेन्युलोमा भी बनाता है, और सुपुरेशन मीन्स इट इज नॉन एज सुपुरेटिव रेडिफाइंग ऑस्टियोमाइलाइटिस. और उसके बाद लास्ट है ब्लू टंग विच आर द टारगेटिंग द वास्कुलर एंडोथेलियल सेल, सो इट इज कॉजिंग द आर्थराइटिस. आफ्टर वन द प्लेग, वेरियस प्लेग मीन्स फाउल प्लेग को क्या बोलते हैं, फाउल प्लेग को हम बोलते हैं एवियन इन्फ्लुएंजा. केटल प्लेग को हम बोलते हैं रिंडर पेस्ट. बबूनिक प्लेग को हम बोलते हैं, क्या बोलते हैं, एर्सेनिया पेस्टिस से जो होता है उसको हम ब्लैक डेथ बोलते हैं. गोट प्लेग हम उसको पीपीआर बोलते हैं, पेस्टिडेज पेस्टिस रूमिनेंस. स्वाइन प्लेग जिसको हम बोलते हैं हॉक कोलेरा, क्लासिकल स्वाइन फीवर. इक्वाइन प्लेग जिसको हम अफ्रीकन हॉर्स सिकनेस बोलते हैं. डक प्लेग जिसको हम बोलते हैं डक वायरस एंट्राइटिस. वाइट प्लेग जिसको हम ट्यूबरकुलोसिस बोलते हैं. रेबिड प्लेग जिसको हम टूलारेमिया बोलते हैं. और लास्ट है केट प्लेग जिसको हम फेलाइन पान ल्यूकोपेनिया बोलते हैं. उसके बाद है काफ़ी सारे डिजीज़ के सिनोनियम है, और वहाँ पे सामने कंडीशन दी है, मीन्स कैनाइन एड्स. तो कैनाइन एड्स जनरली हम बोलते हैं कैनाइन इहेलिचियोसिस. इक्वाइन एड्स हम उसको बोलते हैं इक्वाइन इन्फेक्शियस एनीमिया को. इक्वाइन डिस्टेम्पर हम किसको बोलते हैं, हम उसको स्ट्रैंगल को इक्वाइन डिस्टेम्पर बोलते हैं, जो स्ट्रिप्टोकोकस से फैलता है. फेलाइन डिस्टेम्पर हम फेलाइन पान ल्यूकोपेनिया को हम फेलाइन डिस्टेम्पर बोलते हैं. डोंट बी कंफ्यूज बिटवीन द फेलाइन प्लेग एंड फेलाइन डिस्टेम्पर. कैनाइन डिस्टेम्पर इट इज कॉज्ड बाय द, इट इज नोन एज केयर्स डिजीज. उसके बाद ब्लैक लेग, दैट इज द ब्लैक क्वार्टर. ब्लैक हेड, दैट इज द हिस्टोमोनास मेलियागार्डिस. ब्लैक डेथ, दैट इज द एर्सिनिया पेस्टिस, जो हम बोलते हैं ना जिसको बबूनिक प्लेग, दैट इज द ब्लैक डिजीज. उसके बाद है स्वाइन स्ट्रेंगल जिसको हम बोलते हैं जोवल एप्सिस, जो पर्टिकुलर स्वाइन में मिलता है. उसके बाद काफ़ी सारे टेस्ट दिए गए हैं, और कौन सी डिजीज में वो टेस्ट यूज होती है उसका मैच है. मेलिन टेस्ट फॉर द ग्लैंडर्स, जोनिन टेस्ट फॉर द जोन्स डिजीज जेडी, स्ट्रोस टेस्ट फॉर द स्यूडोमोनास ऑर्गेनिज्म, Coggins test, you remember equine infectious anemia. Escolis test, that is the anthrax. Coombs test, that is for the brucellosis. Wheelbarrow test, that is for the particularly Jainukipathshala test. Jainukipathshala का दूसरा नाम है pulmonary ovine adenocarcinoma. फिर है सिक टेस्ट, दैट इज फॉर द डिप्थेरिया. फिर है विडाल टेस्ट, दैट इज फॉर द पर्टिकुलर टाइफॉइड. और लास्ट में है ट्राइचिन टेस्ट, दैट इज फॉर द ट्राइकोमोनियासिस. आफ्टरवर्ड सर्टेन बॉडीज दी गई है, मीन्स कौन सी इंक्लूजन बॉडी किस डिजीज में पाई जाती है उसके बारे में. बोलिंजर बॉडी, दैट इज ऑब्जर्व इन पर्टिकुलर फाउल पॉक्स. जोसेट बॉडी, दैट इज ऑब्जर्व इन बोर्ना डिजीज. डोहेल बॉडी, दैट इज द राइबोसोमल एग्रीगेट्स इन द न्यूट्रोफिल. कोच ब्लू बॉडी, इट इज ऑब्जर्व इन थाइलेरियोसिस. काउंसिलमेन बॉडीज, इट इज ऑब्जर्व इन पर्टिकुलर येलो फीवर इन मैन. नेगरी बॉडीज, इट इज सीन इन रेबिस. ग्वाइनरी बॉडी, इट इज ऑब्जर्व इन पर्टिकुलर cowpox. LCL body means Leventhal cold lily bodies, it is observed in particular chlamydiosis. Malary body, it is observed in particular alcoholic liver disease. And the last one, that is the Mister's body, that is observed in sarcocystosis. You remember this, all the following very carefully, and you see the video very carefully, and you hear the video very carefully and note down some important point, and at least you hear this video for the 2 times, so you will get the whole the answer very carefully. And it is the very important, means you will get the definitely around the 70 to 80% question from your annual board and any other type of the exams. लास्ट वन दैट इज द रूबास डिजीज, जिसको हम बोलते हैं इन्फेक्शियस कैनाइन हेपेटाइटिस, बेंग डिजीज जिसको हम बोलते हैं ब्रुसेलोसिस, लंपी जो दैट इज अगेन लंपी जो एक्टिनोमाइकोसिस, लॉक जो दैट इज ऑब्जर्व्ड इन पर्टिकुलर टिटेनस, फारसी दैट इज द ग्लैंडर, फारसी इज द क्यूटेनियस फॉर्म ऑफ द ग्लैंडर्स, फिर गैंग्रीनियस मस्टाइटिस दैट इज अ पर्टिकुलर ऑब्जर्व्ड इन पर्टिकुलर ब्लू बेक, उसका नाम है सिनोनिम है ब्लू बेक, समर मस्टाइटिस इट इज कॉज्ड बाय द कोराइनोबैक्टीरियम पायोजेंस, उसके बाद है इक्वाइन एन्सेफेलाइटिस दैट इज पर्टिकुलर ऑब्जर्व्ड इन पर्टिकुलर ब्लाइंड स्टेंगर, उसका दूसरा नाम है ब्लाइंड स्ट्रेगर्स, फिर एस्केरियसिस, एस्केरियसिस विच आर द ऑब्जर्व्ड showing the particular milk spot on the liver, एस्केरियसिस means milk spot, FMD means पेंटर्स, मीन्स FMD के जो सिक्वल है दैट इज द पेंटिंग, उसको हम पेंटर्स बोलते हैं। तो यहाँ तक हमने बात की जो भी ऑब्जेक्टिव पार्ट था। अब ऑब्जेक्टिव में ही एक डिफाइन द फॉलोइंग जो मोस्ट इंपॉर्टेंट डेफिनेशन है उसके बारे में हम चर्चा करते हैं। सबसे पहले है डेफिनेशन रूबास डिसीज, उसके बाद CCPP कॉन्टेजियस कैप्राइन प्लूरोनिमोनिया, फिर है डोरिन, fourth one that is the scrapie, fifth one that is the painting which observed in particular FMD, sixth one biphagic fever which are observed in particular canine distemper, seventh one Milker's nodules which are observed in particular parapox infection, eighth one these are the pica due to the phosphorus deficiency, nine one diamond skin disease, it is caused by the erysipelosis rhizopathy, means you have to the define that particular here I have given the definition, you note down the defined definition and you search definition from whatever I have given the material or also from the JL Vega book in particular pestial pathology portion. Then contagious ichthyma जिसको हम ORF बोलते हैं, हाँ पर्टिकुलर ऑब्जर्व इन सीप एंड गोट, उसके बाद पाइप स्टेम लीवर विच आर ऑब्जर्व इन पर्टिकुलर फेसियोलोसिस, उसके बाद है फॉल्स गिव दैट इज पर्टिकुलर observed in particular nasal myiasis, nasal myiasis. If you are not able to find the answer, you just comment and I will give the answer of the particular definition. If you are not able to find, first you have to find 13 that is the GID, it is caused by the coinuris cerebralis. 14 question means Filberotes which are the particular observed in particular Jacksicte. 15 negri bodies, it is observed in rabies, it is intracytoplasmic inclusion body. 16 wool sorter disease, it is synonym of the anthrax. 17 number sequestrum which are the observed in particular CBPP, contagious bovine pleuropneumonia. उसके बाद 18 boreal body, it is particularly observed in pox infection. 19 means brexy, it is particularly the clostridium organism. You define that brexy, it is a very good question. 20 number that is the milk fever, when it is observed in particular after the parturition, it is due to the deficiency of the calcium. Afterward, second most important part, that is the subjective part. Hope you all understood and got the particular objective part 1. Now we will see toward the subjective part 2. Most important and most IMP question, you must have to read this important question. For the long question, you have to describe the etiology, pathogenesis, lesions and the diagnosis of the following disease. First one, theileriosis, anthrax, Jones disease, foot and mouth disease, rabies, hemorrhagic septicemia, PPR, brucellosis, infectious canine hepatitis, and last one there is the infectious bovine rhinotracheitis. Means for the long question you have to describe the definition of particular disease, etiology, and whatever the pathogenesis and whatever the gross and the microscopic lesion, and finally diagnosis. That's all. Afterward, the most important short note, that is the from the prion disease, that is the bovine spongiform encephalopathy. Then second one, that is the canine ehrlichiosis. Third one, that is the classical swine fever. Fourth one, fasciolosis in cattle. Fifth one, heartpit disease, जिसका दूसरा नाम है canine distemper. Sixth one, that is the black quarter. And afterward, for all that disease, you must remember the various disease of the particular cattle, buffalo, sheep, goat, dog, horse, camel, pig, and cat. Means end list. You prepare the end list of the various diseases like the cattle, rinderpest is there. Particular likewise, the whatever the disease is there, you have to remember like the particular sequence, like the rinderpest, hemorrhagic septicemia, shipping fever, whatever the all the disease which are the important in particular cattle, buffalo, sheep, goat, dog, horse, camel, pig, and cat, you have to the identify like the dog, canine ehrlichiosis, canine parvovirus infection, canine distemper is there, infectious canine hepatitis is there, babesiosis, canine babesiosis is there, likewise horse, strangle, glandar, tetanus. Likewise, in particular, sheep and goat, PPR, enterotoxemia, listeriosis, whatever the disease is there, in particular cattle, buffalo, that is the brucellosis, actinomycosis, actinobacillosis, FMD, hemorrhagic septicemia, rinderpest, which are the important. Likewise, you have to remember like in cattle and buffalo, sheep, goat, dog, horse, camel, pig, and cat. In camel, most important disease that is the trypanosomiasis. Any other all the disease which are the observed in particular camel, but most important that is the trypanosomiasis. In pig, that is this classical swine fever, which are the most important disease, which उसके बाद transmissible gastroenteritis. These are in the cat, particular feline panleukopenia, feline infectious peritonitis, whatever the likewise you should know at least 4 or 5 diseases of the important disease in particular cattle, buffalo, sheep, goat, dog, horse, camel, pig, and cat, bacterial, viral, whatever it may be, whatever the important diseases you must know. Last one, that is the differentiate the following, that is the you must know the difference between the actinobacillosis versus actinomycosis, glanders versus strangles, CBPP versus CCPP means contagious bovine pleuropneumonia versus contagious capra and pleuropneumonia. Then fourth one, that is the tuberculosis versus paratuberculosis, that is the Jones disease. And last one, that is the PPR, Pestides pestis ruminants versus ruminant rinder pest, means PPR versus RP. Means hope you people have enjoyed this video, and this is the most important and the most amazing part of the unit 4, and you must know all the basic thing. And if you read this particular video part, then maximum of the portion or the exam point around the 70% of the exam portion, many time it will be convert into the 100% also, but 70% you will get the definitely question in your every exam. Thank you once again. Thank you, and for regarding the unit 5, I will update regarding the unit 5 video is very soon. Thank you very much. Keep watching and keep updated and stay tuned. If any question you have, any doubt, you just comment. I will reply within the short time, and within 1 to 2 hours I will definitely will reply. Thank you once again. Thank you very much.